Welcome to the first of our two podcasts on the pharyngeal apparatus and facial development in the embryo. What I'd like to point out in this introductory slide is on the right, you can see a scanning electron micrograph looking essentially at the face. This would be the ventral surface of the face where we'll be developing our forehead, our nose. Here are our nostrils, our eyes developing here. And this is going to be the area of our mouth and our neck region. We see these ridged swellings of tissues, and these are going to be our pharyngeal arches. We can see the first arch is actually beginning here in the upper part. This is going to form the portion of the maxillary bone. This is going to form the mandible, and then we have other arches that we refer to as, these are collectively 1, 2, 3, 4, 5 if it forms, and 6 are actually incorporated into this lower tissue and are not visible externally. So we can see these ridges on the outside, these pharyngeal arches. We can see that they have pharyngeal grooves between. One of these will be significant as we go through our development. And on the inside of our pharyngeal area, we see we have an analog to the grooves. On the inside, they're referred to as pouches. Now, there are a number of ways to see these, and in our illustrations, we're going to look at different planes of section. Here we're looking at a sagittal section through the embryo, and we can see the head region. We can see along the back. This is our pharyngeal region that we're seeing here, and it's trying to illustrate these little cutouts. These are trying to illustrate the pharyngeal pouches. They're difficult to see in this particular plane of section. However, if we make a plane of section through the head downward in this direction, and we look at that cut surface, this is what we're going to see. We have our arches. These are going to be our mandibular processes, what we're seeing here. And this is going to be our first pharyngeal pouch, the first pharyngeal groove, this notch right on the outside, which we really have a difficult time picturing here because it's open. And then, so we got the groove, we got the arch, and we got the pouches. But most commonly what we're going to see is we're going to see a section directly through the floor of the mouth and coming through on the back side of the embryo here. So this section, we're going to get a portion of the head, which we see in this area. We're going to have the entirety of the pharyngeal region. And when you lay it open, what we're looking at here is the floor of the mouth. It would be this area here. And then once we get here, then we're cutting through the back of the embryo. Because remember, the embryo is curved. So here we have a portion of the central nervous system, or the head. Here we have a section through the neural tube in this part. And then here's the floor of the mouth, looking at the cut section through our arches 1, 2, 3, and 4. Here we can see the grooves on the outside and the pouches on the inside. This is a view that we're going to commonly use as we go through our lecture. So hopefully this sort of visual orientation will help as we look at the images throughout this unit. So here we are in our 4-week embryo. Again, we're going to be starting back now, and almost every system will come back to this 4th week. And we're going to look at these structures that are going to form portions of the head, the neck, and the face. And in the past, these have been referred to as branchial arches because I think, as you can imagine, some people confused the gill slits that we see here on the shark. These are the branchial arches, and branchial refers to gill, with what we see in the embryo. But we more correctly refer to these now as pharyngeal arches because we don't have gills, and this is associated with the pharynx in the developing vertebra. So we've already viewed most of what we're going to be talking about. We know our pharyngeal arches. We can count them. We can see visually here at 28 days, arches 1, 2, 3, and 4. On the inside, we have the pharyngeal pouches. We can see that first pharyngeal pouch here. The pharyngeal grooves are going to be on the outside. And then the very thin tissue that separates the pouches from the grooves, maybe a little bit of mesoderm between, those are going to be our pharyngeal membranes. Now, I like this illustration because it shows you the different germ layers and what they are going to give rise to during embryonic development. So we're going to take these one at a time as we go through our developing tissues. So we're going to start with the arches. And again, here's the view where we have cut almost coronally through the pharynx. We've laid that open, looking down at the floor of the mouth, and each arch that we can see cut in cross-section in this particular case. We're going to see that each arch is covered on the outside with ectoderm, except for the very first one where we're forming the stomadeum in the beginning of the mouth. The remainder of the arches are covered internally by endoderm, but all have a core of mesoderm. And this mesoderm, by and large, is going to have a large contribution from neural crest cells as they migrate into these tissues. And if we don't have sufficient neural crest migration, we're going to have craniofacial anomalies, one of which predominantly is going to be clefting that we'll see in the palate, or clefting of the lip. That's one of the last places where we form the face, that if we don't have substantial neural crest migration, that's not going to finish off the process. Now, when we look at what's going on here, we've got this contribution neural crest, but our original somatic mesoderm that we have, this is going to be the principal source of the skeletal muscle and the vascular structures that we're going to find present in these arches that contribute to the face. The neural crests are going to come in and contribute the other connective tissue elements in forming the head, the neck, and the face. So as we look at each arch, we can see that the one thing that they have in common, the common components that we have in each arch is going to contain a blood vessel, a cartilaginous structure or cartilaginous rod, muscle progenitor cells, and they'll all have nerves. And each one is supplied by a different nerve. And this is how we can sort of track this through development. And we'll get into the innervation of these different pharyngeal arches as we go through a little bit later. Now, we saw in that first image, the scanning electron micrograph, the first arch is actually a pair of them. This is going to give rise to the structure that defines the stomadeum of the mouth. And we're going to have the maxillary prominence and the mandibular prominence. We give them these terms since we've separated the arch. We're not going to call it a maxillary arch and a mandibular arch. And so the maxillary prominence, it's going to give rise to the maxilla, the zygomatic bone, a portion of the temporal bone in the face and the head. The mandibular prominence, it's going to form the mandible. So here we can see a little bit through development, going from 23 to 26 to 28 days of development. Once again, we can begin to see these prominences occurring on the lateral sides of the pharyngeal area. Here is our oropharyngeal membrane. So we're defining our stomadeum. And then as we go through later and later in development, we can see this combined mandibular prominence is almost fused into the precursor to the mandible. And we're still forming our maxilla here as we're pushing these closer and closer together, this maxillary prominence and the mandibular prominence. The next, we're going to number these as we go. We have arches 2, 3, and 4. And again, these are going to be the principal ones that are visible on the outside of the pharyngeal region. The second pair of arches, they're going to give rise to the hyoid bone. Then we're just going to number these 4 through 6. So here at 4 weeks, 28 days, we can see those 4 arches. The 5th and 6th arches, as we mentioned, are not visible on the surface. The 5th one is really almost going to coalesce in with the 6th arch as we go through development. So it's not going to play a huge role in what we're going to be talking about as far as development of structures. Now, just an overview of stepping through development. And again, we're going to go back and look at arches, pouches, grooves, and membranes and what adult derivatives they form down the road. But as we go from our 28-day picture that we see here, now we can go to day 32. We can see that we're forming the arches. The head is growing and extending. And as we look inside at that cut view, we can see that arch 2 is growing much larger and faster than arches 3 and 4. And so we're going to have this differential growth, and this is going to help define some external structures and internal. Here we are, day 33, a little bit further along. We continue to get the overgrowth of 2. We're really losing the groove type structures that we see between 2, 3, and 4. The pouches are somewhat going away as well. And by the time we get to day 41, we can see that we have really smoothed over the outside of the body except for groove number 1. And our pouches on the inside, except for pouch 1, are really coalescing inside this other tissue, and they're going to assist in forming some hormonal glandular type structures as we go through these processes and look at these different pouches. So you can see there's a lot of morphology, that's morphogenesis that's happening, a lot of change in this neck region, and it's quite complicated. I want to give you this overview first, and now what I'd like to do is step through one of the first of several animations we're going to have to kind of step through this a little bit in time-lapse view using computer animation to give us a better understanding about this early movement and morphogenesis happening with the pharyngeal apparatus. Now let's begin to look at the structures that are derivatives of our pharyngeal arches. We're going to start with the arches and we'll work through the grooves and the pouches and the membranes. So in the first arch, our skeletal structures, we refer to, and this is sort of old classical comparative anatomical terms, we refer to the first arch as Meckel's cartilage. This is from the shark. And in the first arch, certainly we're going to have the maxilla, but we're going to have the mandible as well, but also derived from that we have the malleus and the incus. These are two of the small bones in our inner ear. The second arch, which is referred to as Reichert cartilage, again from shark and comparative anatomy, the stapes, the third of those small bones, and then the styloid process, that portion of the temporal bone is derived from second arch tissue. The third arch primarily is going to give us the body of the hyoid bone. This is going to, for many vertebrates, be around the laryngeal region of the neck. And then the fourth and the sixth arches, these are going to contribute to the cartilages of the larynx. These are the thyroid, the cricoid cartilage. And as we've mentioned before, the fifth arch really doesn't form that well. It's mostly overridden by the fourth and the sixth, so it's difficult to recognize. And so we refer to the fifth arch as rudimentary. It may exist in some lower vertebrates, but not in humans to any appreciable amount. And thus we have no cartilage or skeletal structures forming from fifth arch tissue. So here we put it together. We color-coded the first, the second, the third, and the fourth and sixth arches. And we can see those derivatives present, the malleus and the incus, the stapes and the styloid process. Those are going to be second arch. Third arch, the body, or they refer to it as the greater cornu, or horn of the hyoid bone. And then the fourth and sixth, these are going to be our thyroid and cricoid cartilages that we find. So the hyoid is not an extremely important structural component in human anatomy, but we do mention it here as being derivatives of this arch tissue. Now, muscular components. The first arch, we're going to get muscles of mastication. Remember, we have muscle precursors present in this arch tissue as well. The second arch, muscles of facial expression. The third, stylopharyngeus, is the muscle derived from the third tissue. And the fourth and the sixth arches, we're going to see striated muscles of the esophagus, and then the pharyngeal and laryngeal muscles. Now, we say striated muscle esophagus because you remember the esophageal muscle, the upper third is going to be striated. It's going to be voluntary. But as you move lower and lower down the esophagus, you have a transition from striated voluntary to smooth involuntary muscle. So once again, we've color-coded our arches and the arch derivatives. That first arch there, we can see the masseter muscle, mylohyoid, temporalis, again, muscles of mastication. The second arch, we've got our muscles of facial expression. Orbicularis oris is the mouth. Orbicularis oculi is the eye. Then we also have the frontalis, which is our forehead. So the muscles of facial expression. Then we have the third arch. There we see the stylopharyngeus. And then the fourth and sixth, that's going to be associated with our pharynx and esophagus. Nervous tissue. As we look at our nerves, we're going to see that the trigeminal nerve, cranial nerve number 5, this is going to serve a broad range of structures. We've got motor nerves for the muscles of mastication. We have sensory nerves for the face, teeth, palate, mouth, and tongue. So the trigeminal nerve, number 5, this is going to serve our first arch derivatives. You can see the maxillary division in purple. We've got the mandibular division in blue. And then we can see we have other cranial nerves that are going to serve the other components. We've got the facial nerve, we've got the glossopharyngeal nerve, and then we have the vagus nerve. So here's a chart that simply shows the arch tissue, the nerve that is innervating that particular area and derivatives. We have the muscles, and we've eliminated some of these that you've seen me draw the line through. And then skeletal structures, these are the ones that I want you to familiar with as far as derivatives of these arch tissues, skeletal muscle and innervation. Now we move on to the pharyngeal pouches. Remember, these are going to be on the inside, and most of these are going to be endodermally derived. So let's see what becomes of our pharyngeal pouches. So here we have, again, this coronal section through the pharynx. We can see our arches, and this is a little bit later stage of development, maybe about 32 days of development, and we don't have the nice round arch tissue anymore. Here we can see arch 2 is overgrowing. Arches 3 and 4, we actually have arch 6 kind of overgrowing here as well. Trapping in place these grooves in this area, we're going to collectively refer to this as cervical sinus. It really doesn't play a huge structural role unless it persists. But we're going to look at the inside, and here we can see our pharyngeal pouches. We can see pouch 1, 2, 3, 4. And as we go through this, we're going to see what becomes of them. So, pharyngeal pouch number 1, this is going to become the tubotympanic recess, and that's what we call it during developmental terms. But later, we're going to refer to this as the tympanic cavity. So this is going to be your inner ear. This is going to be the area that is medial to the tympanic membrane. And I think you can already figure here in groove 1, this is going to be the tympanic cavity. We'll go ahead and give you this little bit of a preview. Groove 1 on the outside, this is going to be your auditory meatus, or your ear canal, which means the membrane here for 1, that's going to be your tympanic membrane or your eardrum that separates the external canal from your tympanic cavity. So we're creating the area for our ear and eardrum with pouch 1. There we can see the membrane. It's going to be the tympanic membrane. Now, as we extend this tubotympanic recess, we're going to continue to have that connection with the pharynx, and this is going to become our pharyngotympanic tube. We more commonly refer to this tube as the eustachian tube to help us equalize pressure in the pharynx and our internal ear. So as we step through development, once again, we look at our first pouch tissue. A little bit later, we can see that we're extending that even further down. We're creating our tympanic recess. There we have our tympanic membrane. There's our external acoustic meatus, or our external ear canal. And again, we're going to maintain this connection that we see with our pharynx to help equalize pressure. It's going to be our eustachian tube. Here we can see a little bit later, we've almost obliterated all of our other pouches. We can see our grooves are almost completely gone. But here, groove 1 and pouch 1, this is going to be for our hearing, and then we're going to have our tympanic membrane. So pouch 2. Pouch number 2 is almost going to completely be obliterated, but we're going to sequester some of this endoderm inside the mesodermal tissue, and this is going to be our tonsillar sinuses, and then later in development, these are going to be our tonsillar crypts. If you look at your palatine tonsils, you're going to have these holes or grooves that go down inside of the tissue itself. Those are our tonsillar crypts, and that's where we're going to find the second pouch tissue giving rise to that. Now, our third pouch, this is where it starts to get a little interesting, because the third pouch we're going to divide in half, and we're going to have an inferior and superior portion. We're going to refer to this as the superior portion of the third pouch. This is going to be the inferior portion of the third pouch, and it's going to be a little bit confusing as we use these terms. You might want to think of this as cranial and this as caudal, because we're going to be using terms like inferior parathyroid and superior parathyroid, and those are referring to where this is going to end up, not where it starts. So this dorsal portion, this more cranial portion, superior portion that we have right here that we're pointing out, this is going to give rise to the inferior parathyroid gland. And as I mentioned in the lecture when we talked the other day, as we watch the movement of this material, it's going to move downward, and structures that are more superior in the beginning here in the embryo, or dorsal if you want to think of, these are going to move downward and lower, and they're going to become inferior. They're going to flip upside down as they this relative migration as it occurs during development. Now, this more inferior portion, or think of it as ventral, or think of this as caudal, this portion of the third pouch is going to give rise to our thymus gland. We're going to have a portion coming from the right side, we're going to have a portion coming from the left side, and they're going to unite together in the midline to form our bilobed thymus. Now, the final location of the thymus, we refer to this as the mediastinum. We saw this as we folded our embryo together. This is going to be this almost central core of constructal tissue, almost like an I-beam, right in the center of your chest. And the thymus is going to be sitting right at about the point where we have our aortic arch coming off of our heart. That's going to be in the superior part of the mediastinum. So here we can see this relative migration. We have refined our first pouch and groove into our external ear, internal ear, our eardrum. We have our tonsillar crypts, these sort of invaginations into our mesodermal tissue. That's going to be endodermally derived, so they keep that yellow. Then from our third arch, we can see this relative migration. So the inferior parathyroid is going to be coming down here. We have the thymus coming down, and here's our bilobe thymus. And then from pouch 4 that we're going to cover next, we're also going to see that migration. It's not going to be as far as 3. See, 3 is coming down first. 4 is going to come down and stop a little bit shorter, so it's going to be more superior now. It started out inferior, but it's going to be superior in its final adult positioning. So our fourth pouch, we're going to have the same situation. We're going to see the upper portion, or again, dorsal or cranial. This is going to give rise to our superior parathyroid, and then the lower or ventral portion, caudal portion, is going to be the ultima branchial body. Now, you may not be familiar with the ultima branchial body. It exists in some lower vertebrates, but the ultima branchial body essentially is going to break apart. It's not going to be a recognizable structure in adult humans, but it gives rise to certain cells, and these are the parafollicular cells surrounding the thyroid, and that's going to produce the C cells that make calcitonin. Now, the fifth pouch, we do have somewhat of a rudimentary fifth pouch, even though we don't have a fifth arch, and it, if it does exist, is going to give rise again to the ultima branchial body and contribute to portions of those parafollicular cells that are present surrounding the follicles of the thyroid gland. Now we have an animation putting together the development of the pouches and their final adult positions. So please watch that now. So why is that still there? So as we return, the last components to cover are simply the pharyngeal grooves and the pharyngeal membranes. And I think from what we've discussed before, it's not going to be surprising that we really only have to deal with the first. The first groove is going to become the external acoustic meatus, or external ear canal, and the first membrane is going to become the tympanic membrane. Now, membranes, remember, are basically endoderm and ectoderm with very little mesenchyme between. Now, all of the other grooves, all of the other membranes are going to be overridden. They're going to degenerate, and they're not going to form any sort of structural feature that we can identify or speak of in the adult. Now, to return back to our pouches, we have a unique situation occurring, which is going to be our thyroid gland. Now, the thyroid gland is going to be the first endocrine gland to develop in the embryo. It is a pretty important gland as far as metabolism, reproduction goes. And we're going to see that in the floor of the pharynx. Now, this is not one of our pouches. It's in the region of the pouches. But we're going to see that in the floor of the pharynx, around day 24, we're going to see an outpocketing of tissue. And this endodermal tissue, this outpocketing, is going to dive down into the underlying mesodermal tissue as the thyroid diverticulum. Now, the thyroid diverticulum, a diverticulum is a blind-ended pocket off of the esophagus and the digestive tract. So the thyroid diverticulum descends, and as it does descend, it's going to leave a connection back to the pharynx along with it. And this connection is going to be the thyroglossal duct. Now, in most cases, the thyroglossal duct degenerates as the thyroid diverticulum descends and becomes the thyroid tissue proper. Now, as the thyroid descends, it's going to be divided into a lobe structure, and in many cases, it's going to be connected across the midline by an isthmus. So it's going to look somewhat like a butterfly as it descends, and it forms around the laryngeal region of the pharynx. Now, we can see the thyroglossal duct descending. The opening back to the pharynx is going to be the foramen cecum of the tongue. Now, this is all that's going to persist, is a little indentation. But that foramen cecum is going to be the connection of the thyroglossal duct. And as the thyroglossal duct degenerates, this depression on the back part of the tongue, that foramen cecum, that's going to be the remnant then of the opening of the thyroglossal duct that was present during embryonic development. Now, we often see at the isthmus, there's a portion of the thyroglossal duct that is proximal to the thyroid gland that may not degenerate and become thyroid tissue. And in about half of the population, that extra thyroid tissue is referred to as the pyramidal lobe. You can see that sticking up right in this location. And that, again, is remnant of our thyroglossal duct. Now we have an animation showing the pouches, grooves, and the descent of the thyroid gland. Now we've developed much of the structure that we have present in our pharynx. We have derived our salivary glands, or we will. We've derived some of our thyroid glands, our endocrine glands. So now we're going to look in the floor of the mouth, because we're going to derive the tongue now and begin to shape the tongue and the pharyngeal region. So again, near the end of this 4th week, and that's our magical time period, we're going to see in the floor of the pharynx, we are going to develop median tongue bud. Now, the median tongue bud, and in this case, they're referring to it as the median lingual swelling. This is the new sort of language in the book. This median tongue bud is going to be very central here between the first and the second arch tissue. It's coated in blue, so it's derived from first arch tissue. But that's where we're going to find it. It's just going to be rostral or cranial to the foramen cecum. Remember, this is the opening and the depression that was left from the thyroglossal duct. So there we can see our single median tongue bud or lingual swelling. Now, just in front of this median tongue bud, this is going to be an inducing center here. This is not really going to have a lot of structural significance. But this is going to induce the tissue in front and lateral to it to enlarge, undergo a lot of mitotic activity, and these are going to be the distal tongue buds, also known as the lateral lingual swellings, and these are paired structures. These are going to give rise to the bulk of the tongue. Once again, both the median and the distal, or in this case lateral, these are going to be first arch derived tissues. Now, these are color-coded, so the anterior 2/3 of the tongue, they refer to this as the oral portion. This is going to be derived from those distal buds, the distal swellings, or the lateral lingual swellings. And then we're going to see that separating, really, the oral portion from the pharyngeal portion of the tongue, we're going to have this V-shaped depression. This is called the median sulcus, or sulcus terminalis. And this sulcus terminalis is going to have a point. The vertex of this V is going to be at the foramen cecum. That's one way you can find that. The median tongue bud, contributes nothing to the adult tongue. It is only there is an inductive center to organize the remainder of tongue as it's forming. Now, the pharyngeal portion of the tongue, this posterior 1/3, we're going to see that this is going to be derived in part from second arch tissue, and there is the structure that we know as the copula. This is going to be second arch tissue. But we're also going to have this structure known as the hypobranchial eminence. You can see this is going to be somewhat of an egg-shaped structure, and it's going to be contributed from third arch tissue and fourth arch tissue. It looks like the line is just going to this back part, but this is the entirety of this structure. It's composite of third and fourth arch tissue. So the copula and the hypobranchial eminence are going to contribute to the pharyngeal portion, this posterior 1/3 of the tongue. And again, as you look at the coloring, we can see that we are going to derive portions of this posterior third from second, third, and fourth arch tissue. One way that we can definitively show that is the innervation of the tongue. We're going to see that the tongue is innervated by all 4 of our cranial nerves, which are going to be feeding or innervating all 4 of our pharyngeal arches. So now let's look at an animation on the development of the tongue.